Hello, this is Dr. Gerard Cuomo. I'm here in my Boca Raton office going over Marge's case. And this is a video for my laboratory in Deerfield Beach. It's Toby Nielsen Dental Lab. And right now Marge presents with her case prepared and temporized. And we did that to allow the soft tissue to migrate into the area and to help develop the papilla. So we noticed that we did get some nice growth of the interdental papilla, but we still have a slight triangle in the anterior, but certainly not as much as what we began with. We also noticed that the contours of the teeth are slightly over contoured, but our patient actually likes the look, and it looks very natural for her. We also noticed the lingual aspect of the provisionals to copy the envelope of function of the bottom teeth. I just need a little suction here on the right side. And this area of concern, thank you. That's fine, you can take that out. Has to be duplicated in the final. So let's zoom in on that. Very important that if this were to come back from our laboratory with a flat surface like number 9, we'd end up having to grind on that in the mouth. So this tooth, because it's out in occlusion, it's out on the labial aspect of the lower arch, we would have to develop this in the final. So very important to note that in the laboratory fabrication slip. Alright, and Marge likes our color. We did select a light ivory color from the triad. I believe these are triad temporaries, but they're lined with a bleach shade of our integrity. So first thing we did was we looked at the color now that things have settled, and we noticed that using the Vita Shade Guide, these are our colors, and B1 might be as closest to the temporaries, but you noticed her enamel that flanked the temporaries, especially the lateral and cuspid. There is a small little composite there that's discolored, and she also has some recession as well that eventually will be addressed. And so contours, possibly these might be a little too far out on the distal line angle. Maybe we can narrow that a little bit slightly, as well as in between, to make them look more individualized. But as far as the color, I don't want to bounce back and forth. We had between a B1A1 was right in there. I wouldn't say too much lighter than this. So there's going to be a blended color that my technician will have to consider. Now, whether or not we go with a zirconia core that's milled and then pressed to that is going to be the next question. So it's all going to depend upon the shade of the stump shade. Alright, so what we're going to do is we're going to release these two temporaries from behind, take them off, clean them up, measure the thickness of the temporaries so we know we can judge where we are as far as our overall reduction, and check also the incisal reduction as well, and then we'll move forward. Speech is okay, aesthetics is fine, no one's noticed that she's wearing temporaries, that's a good sign. So we'll be back at the next segment with the stump shade. Dr. Gerard Cuomo in Boca Raton. Thank you.